Infertility. What is infertility? The World Health Organization defines infertility as a disease of the reproductive system defined by the failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. Male infertility is considered when the man has problems with producing sperm or sperm motility. Female infertility, on the other hand, can be caused by a variety of issues. The woman may have endometriosis, blockage in her fallopian tubes, have problems with ovulation, be advanced in maternal age. My partner and I have been trying to get pregnant for months. Should we go to the doctor? If pregnancy tests keep showing just one line, schedule a visit with an obstetrician-gynecologist. You can go if you've been having unprotected sex regularly for a year. You can go see a doctor together sooner if you or your partner have these conditions and have been trying to get pregnant for 6 months. Over 35 years old. Irregular periods. Pelvic inflammatory disease. Endometriosis. Polycystic ovarian syndrome, PCOS. Cystic fibrosis. Thyroid problems. Had an ectopic pregnancy. Repeated miscarriages. Injury to the scrotum and testes. Erectile problems. Ejaculation problems. What happens at the fertility specialist's clinic? The consultation will start with a thorough interview. Some of the questions to expect are: the frequency of sexual contact, what kinds of birth control you've used, if you've had sexually transmitted diseases, whether you've been pregnant or your partner had gotten someone else pregnant before, if you've seen another fertility specialist and what treatments you had, what tests will be prescribed. Pelvic ultrasound. This test uses a vaginal probe that transmits sound waves to examine the woman's ovaries and uterus. Cervical mucus test or post-coital test. For this test, a woman will have to have sexual intercourse in her mid-cycle to evaluate the quality and quantity of her cervical mucus. Hysterosalpingogram, HSG. Endometrial biopsy. This test will check if the woman can sustain a pregnancy, performed after day 21 of the cycle. Laparoscopy. Pelvic adhesions. When female reproductive organs stick to each other or other abdominal organs like bowels or abdominal lining. Endometriosis, a painful condition where the uterine lining bleeds excessively. Semen analysis. This fertility test involves a man collecting a sample of his ejaculate. It can take over several months for your doctor to determine the cause of your fertility problems, so be patient and don't get discouraged. Fertility tests to help conception can be anxiety-inducing and expensive, but they are done to help your doctor arrive at the proper treatment for you and your partner.